Barbara Stewart.
Thank you very much, Mr Chair. I'm pleased to rise to take a call on behalf of New Zealand First on the annual review of the health sector. Mr Chair, the Minister continues to tell us at every opportunity that he can that the health system is in good shape and that we're heading in the right direction. We are hearing the increasingly loud voices of the people out there who are telling us that this is definitely not the case. We, and they do too, hold grave concerns for the future of our health system because the ambulance at the bottom of the cliff is ailing, which is a very unfortunate situation. The chronic underfunding is basically putting a huge strain on our health services and putting our system at risk. Many DHBs aren't able to fund a safe level of staffing in our hospitals or even keep annual leave at a manageable level, and yet we've read this many times in the newspaper. The medical staff are saying that their workloads are unsustainable and that they are being forced to do more and more with less. It's not a safe situation, and patient risk is basically being patients are basically being put at risk. Mr Speaker, I had the very fortunate meeting with somebody in a plane going back to Hamilton. Going back to Hamilton, who said that, in his opinion, the nurses and the doctors go beyond the call of duty to look after the patients. Despite the fact that they're stretched, they do far more than they actually should. HDU and intensive care, we know that those staff go beyond the call of duty. This gentleman said that the care that his son received was absolutely outstanding and couldn't be faulted. Excellent. He also praised the hospital air service that flies from New Plymouth to Hamilton. And again, the care in there was outstanding. So we've got our staff working to the best of their ability despite the lack of funding. We know too that DHBs are unable to cope with the demand for elective surgery. While the number of surgeries has increased, and the Minister tells us that every day, it's simply not enough to keep up with demand. We've got an ageing population, we've got a sharp increase in chronic illnesses, and all of this is putting pressure on the health system. And what have we seen? The DHBs having to raise the threshold to ensure that people have to jump through higher hoops to actually qualify for surgery. And the result is that we have people who are becoming more and more disabled and who are left in chronic pain to try and cope until they can have surgery. Performing operations when they are needed makes sound economic sense, and of course it saves money. Had one instance recently of a gentleman coming to visit me in my Hamilton office who said that he needed a heart operation, but the hospital had told him that they didn't have the money to actually carry this out. And this doesn't sound like the health system that we've had in the past. Pharmac too are severely underfunded, meaning that more and more New Zealanders are missing out on vital medicines. Those who can afford to pay for them privately or through private health insurance definitely receive them, but for the rest of the people, it is just about impossible. They're left to manage as best they can. We have never ever had a two-tier health system here in New Zealand where those who can afford treatment get it and those who can't basically go without. When we look at cancer, we're lagging behind Australia in this area too. Up in the Waitemata DHB, the bowel cancer screening program is absolutely outstanding, saving many people every year. But why hasn't this program been extended to other DHBs? It's actually saving lives. I'm hoping that the Minister is going to announce this in the budget this coming year. An election promise is too late. We'll lose another 1,200 people to this disease. When we have a look at obesity, The number of obesity is reaching chronic levels. We need a public education program.
I call Barbara Kuriger.